We now prepare to expose the neurovascular structures which lie within the femoral triangle. We show the inguinal ligament, which is the base of the triangle, running from the pubic tubercle to the anterior superior iliac spine, the medial border of the Sartorius muscle, and the lateral border of the adductor longus. These muscles meet at the apex of the triangle. Within the triangle, we see the femoral sheath. We will incise it to expose the femoral artery and vein, and laterally, we will identify the femoral nerve. We are now incising the femoral sheath to reveal the femoral artery and femoral vein. The femoral artery and vein are now coming into view. We now see where the two branches of the saphenous vein drain into the femoral vein. We continue our exposure of the femoral sheath. We show the femoral artery laterally and the femoral vein medially, and we show a septum within the sheath that divides the femoral artery from the femoral vein. The superficial location of the vessels within the femoral triangle allows for palpation of the femoral pulse and for central access through both the femoral artery and the femoral vein. We are now dissecting lateral to the femoral sheath to expose the femoral nerve. The femoral nerve lies lateral to the femoral sheath and medial to the Sartorius. In this location, the femoral nerve is now coming into view. We have placed a probe underneath the femoral nerve just as it passes deep to the inguinal ligament to enter the thigh. The femoral nerve is composed of the ventral rami of the second, third, and fourth lumbar spinal nerves. It provides motor innervation to the muscles of the anterior thigh, cutaneous sensation to the anterior thigh, and to the medial leg as far distal as the great toe. We now retract the femoral artery to show the large, deep femoral artery, or profunda femoris artery. This artery supplies most of the muscles of the thigh. The proximal portion of the femoral artery is often called the common femoral until the branch point of the deep femoral artery. We retract the femoral artery medially and the Sartorius laterally to show again the deep femoral artery. We see a large branch, the lateral femoral circumflex artery, which supplies the lateral thigh and has a branch which ascends superiorly to join the plexus around the greater trochanter. We've retracted the femoral artery laterally. We show the deep femoral artery, and we show the medial circumflex femoral artery, which supplies medial thigh and has an ascending branch which supplies the head of the femur. Medial to the femoral sheath, we show the femoral canal, which has a pad of fat and a lymph node. This is a location for femoral hernias, particularly in women. We now incise the inguinal ligament in order to show the continuity of the vessels and nerves. We have removed the inguinal ligament. We show its attachment medially at the pubic tubercle and laterally at the anterior superior iliac spine. We see the external iliac artery and vein passing deep to the inguinal ligament to become the femoral artery and vein. Laterally, we can see the femoral nerve passing under the inguinal ligament. Deep to the femoral nerve, we see the iliacus muscle. Deep to the femoral artery, we see the psoas muscle. Medially, we re-identify the femoral canal and show a lymph node superior to the inguinal ligament.